Welcome back to the show Talk with Your Doc. With me is Sarah Miller, who is a registered dietitian at Thunder Bay Regional Health Science Center. Sarah, you were mentioning about eating the food at frequent intervals, every 4 hours, a small amount of meal. So how many calories in the breakfast, how many calories in the lunchtime? Should there be any particular distribution of the calories?
So again, that's going to depend on a patient's or a person's individual overall calorie needs. Generally, for the average person, I usually counsel around 400 calories, 400 to 500 calories per meal. And that leaves a little leeway if patients want to snack between 100 or 200 calories per snack if they're using that. But I find a lot of patients are very resistant to actually counting calories. So sometimes what can help is using what I call, and I brought my little prop with me here, is a healthy plate concept. So if we think about a healthy plate, it's more of a portion-based idea, where a quarter of your plate is a protein-based food, a quarter of your plate is a starch or a grain-based food, and then half your plate would be your vegetables or fruit. You may have a small amount of dairy food on the side, or dairy can sometimes be substituted as the protein. But some patients do better with this kind of concept to help control portions versus a calorie counting concept. So we can work either way with patients that way.
Now, they say that you should have a breakfast like an emperor, lunch like a king, and the dinner like a beggar.
Sure.
Can you explain that a little bit more?
Sure. The theory with that is that, or the idea around that is that you're eating more of your calories during the active part of your day. And again, that's going to depend on the individual. But generally for patients who are getting out of the house and working and moving around during the day, most of their calories are being burned through the daytime hours or before our dinner. Whereas after 5 o'clock, we tend to be much more sedentary. We're watching TV, or we're using screens, or we're in our home not doing much for most people. And so the theory there is that you're burning off more of the calories if you're eating more earlier in the day.
Right. Now, eating fast food in the restaurants, how does that affect the diet?
So it's pretty common knowledge for most people that fast food is a source of high calories and high fat. Oftentimes when I meet with patients, you know, they're reluctant, or they feel like they're confessing their sins to me when they tell me that they eat fast food. And it is very true. Eating a lot of meals away from home using drive-through or convenience foods at restaurants may contribute to a higher calorie intake. But it's not always that simple. You have to take a look at their overall diet in context of how often are they using the foods, and what are the portion sizes and choices. People do need to be careful at fast food restaurants these days, because restaurants have picked up on this healthy eating idea, and they've often incorporated many alternative options that some consumers may perceive as being healthier, things like wraps or salads or grilled meat options. But you have to look a little deeper at some of those things. They're often loaded with a lot of high-fat sauces and dressings and cheese, and so you need to be well informed. Some of those options may be higher, even higher in calorie and fat than some of the traditional counterparts.
So the fat which we eat now, there are various types of fat: saturated, unsaturated, polysaturated, monosaturated.
Right.
Can you please explain us about advantages of having different types of fat?
Right. And this is often a lot of clarification that I make with a lot of patients. So you're right, there are two different categories of fats, the saturated and the unsaturated. Your saturated fats are all of your animal-based fats, or what I usually say, if it was an animal or it came from an animal, it's likely going to have some naturally occurring saturated fat. Saturated fat is also found in palm and coconut oil, as well as lard and shortening that are solid at room temperature. These foods increase our bad cholesterol, or our LDL, okay? Trans fat are another kind of a saturated fat that are also naturally found in small amounts in meat, dairy, but are also industrially developed or processed and added to a lot of packaged foods, so you have to be careful there. Trans fats are also known to increase our bad cholesterol, but decrease our good cholesterol. So they are highly associated with heart disease or heart attack risk due to that increase in the cholesterol levels. Alternately, the unsaturated fats are very good for our health. And those are the mono and polyunsaturated fats, or MUFA and PUFA, we call them for short, are found in, polyunsaturated are found in fatty fish, nuts and seeds, certain types of oils, whereas the monounsaturated are found in avocado, nuts and seeds as well, and other types of oils as well. These fats, although better for our health in terms of no effect on the cholesterol, still calorically are the same as saturated fat. So that's where some of our patients who are trying to manage their weight or watch their weight get into trouble, because they are using a lot of unsaturated fats thinking that they're healthy for them. Calorie-wise, they're exactly the same. So you do need to be careful and still modify or watch your portions of the unsaturated. The recommendation, I think, is about 2 to 3 tablespoons of unsaturated fat a day.
Right. So when we choose the diet or food, we should look for unsaturated fat.
Unsaturated choices, or more plant-based choices.
Vegetarian
type or vegetable type choices.
Now, how about the proteins and the health? So obesity, there are various types of diets now, and one of the concept is high protein, low carb diet. Right. Can you please explain about this diet concept?
These are very popular right now. Everything from ketogenic, paleo, Atkins, these are common diets that I have patients who have lots of experience following. The research is very mixed, or the information is very mixed. It depends on who you ask, and it's quite controversial. But overall, research shows that no matter what the composition of the diet, it matters what the calorie intake is. Some of these high protein, low carbohydrate diets put you at risk of micronutrient deficiencies, as well as typically are associated with higher saturated fat intakes, because they do heavily encourage meat and fat intake as opposed to carbohydrate intake, where we see at 1 and 2 year studies that overall what mattered was the amount of calories people were taking, not the composition necessarily. So following a high protein, low carb diet may be beneficial, but it depended on what the calorie intake was for long-term weight loss, okay? But that's also different than health risk, okay?
So high protein and low carb diet may lose the weight in the beginning stages.
Right.
But then the source of the protein is where it causes the harmful effects.
That's right.
What is the difference between say we get a lot of proteins from the lentils, vegetarians,
yeah,
and we get the proteins from the meat, red meat. Is that what makes the difference in the choice of proteins?
It can. There is lots of research that suggests that high dietary intakes of red meat in particular, which would include red meat, beef, and pork, do lead to higher risk of bowel cancers specifically.
Yes.
And so watching your intake, I believe that the recommendation from the Cancer Association is about 16 ounces a week of no more than that of red meat and processed meat. So that's going to be things like bacon, ham, some sausages, some processed sausages. When we look alternatively at something like lentils or other type of legumes or pulses, these vegetarian sources of protein do provide a lot of health benefit, what we call cardioprotective, in that they have what's called high intake of phytosterols, which are sort of plant compounds that are good for your health promoting. But not only that, they're low in saturated fat, high in unsaturated fat, high in fiber, and tend to be lower in calories overall.
Yes.
So that can have, and naturally low in sodium as well.
Yes.
So that can have a cardioprotective effect and help manage weight. So even I encourage, having a meatless meal, replacing red meat 1 to 2 times a week with a vegetarian type meal that includes that for better health.
Thank you, Sarah. We'll take a short break and we'll come back. Please stay back for the next part. Thank you.